Welcome back. Nepotism, corruption and jobs for sale. These are some of the allegations levelled against the CEO of the Bheki Mlangeni District Hospital in Soweto, Ruth Mabyana. There are also claims of a cover-up after a 16-year-old patient was allegedly raped at the hospital. Mabyana has since been placed on precautionary transfer. That's while investigations are underway. Joining me now to get reaction to this is Buang Jones. He's with the South African Human Rights Commission. Buang, a very good evening to you. Thank you for being on SA tonight. So, a laundry list of allegations against the hospital and the CEO. What is the Human Rights Commission's take?
Well, Bheki Mlangeni Hospital is one hospital in Gauteng that has been limping from one crisis to another. We are not surprised by the steps that the Department of Health has taken to put her on precautionary suspension or transfer. We are, however, deeply concerned and horrified at the alleged rape in the hospital premises. And we hope that the MEC will launch a full investigation into this and that perpetrators will be brought to book. The Commission has made contact with the MEC earlier today to inform him of our intention to visit the facility on Monday.
So when you visit the facility on Monday, what will you be looking for specifically?
Well, we have previously heard of concerns relating to critical staff shortages, beds, and last year we embarked on a separate visit to the hospital. But we did not get an opportunity to engage with staff members, with the security personnel at the hospital. We want to have a candid discussion with the hospital management. We also want to get an opportunity to interview staff members at this hospital to probe some of these allegations concerning the CEO, appointments, and above all, we want to look at this issue of security. It's not just this incident that happened recently. There have been other attacks at the same hospital over the last couple of months, and we hope that the department will review its security measures at this hospital, because the last thing you think of as a patient is security. And unfortunately, patients who rely on this hospital have to now worry about their security when they visit this hospital.
You intend to speak to staff when you go to Bheki Mlangeni Hospital on Monday, but our reporter Masihora Hlaga yesterday put together a report for us where she spoke to some workers at Bheki Mlangeni, and they basically cited an environment of fear where they claim, for example, in the case of the 16-year-old patient who was raped allegedly at the hospital, they were forced by those in charge to give false statements. They say there's a constant fear that they live in. Does that worry you then about how willing they may be to come forward and speak to the Human Rights Commission come Monday?
Well, the visit on Monday will be the start of our own investigation into this matter. This investigation will also require other key role players like the law enforcement agencies, the Office of the Health Standards Compliance, to look at the hospital's compliance with the norms and standards. The Commission is one of the designated institutions in terms of the Protected Disclosures Act, and we hope that the hospital staff will come forward with information that will assist our investigations. We are impartial, we are an independent constitutional body, and they should trust us with the information they will furnish us when we interview them.
This is not the first time that a public hospital is in the headlines for the wrong reasons. You had to intervene in Pretoria, I remember, in the Martha Murray case when she was abused at a public facility. And the problems are many. What is at the root of the dysfunction in the public healthcare sector in South Africa?
At the root of dysfunction is poor governance, poor accountability structures, corruption, and maladministration. The Gauteng Department of Health has been plagued by a number of challenges over the last 15 years. And this manifests itself through some of the challenges that we have picked up during our investigations. Issues concerning critical shortages of beds and staff, shortages of medical equipment, and leadership instability. We've seen some hospitals that have been without CEOs for prolonged periods, We've had incidents of poor staff attitudes. The Matamare incident was just one of the many examples of the lamentable state of the healthcare system in Gauteng. Even the Premier of Gauteng, in his State of the Province address, stated that the healthcare system in Gauteng suffers from what he termed believability, and that there is a need to restore the public's confidence in the system. And we hope that through our intervention, through continually engaging with the relevant role players, we'll be able to find solutions. But we hope that when the Premier appoints an MEC, that one of the key things they will do is to address leadership deficiencies at some of the hospitals, because there has been deaths as a result of infections due to unsanitary hospital conditions. There has been other challenges in many hospitals, including poor physical infrastructure. Mamelodi Hospital, for example, needs urgent attention from the department. The hospital has to be expanded because of the growing population. The Thembekile Hospital has been a problem for many years now. And we have not yet seen a decisive intervention from the Department of Health to address all these issues, to ensure that the distinctive needs of healthcare patients are prioritized.
Buang Jones from the South African Human Rights Commission, always good to speak to you. Thank you.